आदरणीय गुरुवर्य प्रोफेसर सर, पेंटे सर, प्रसाद सर, मित्रवर्य, काळे सर, निलेश सर, सर्व उपस्थित विद्यार्थी व विद्यार्थी, आपण थोडक्यात ह्या विषयाला सुरुवात करूया. मी बोलताना जरा मंगली भाषेमध्ये बोलेन. हा विद्यार्थ्यांसाठीचा जो जास्त आहे तिथे जरा भावनांचा उल्लेख करण्यासाठी मराठी भाषा जास्त योग्य राहील, पण जे कम्युनिकेट सरांपर्यंत व्हावं असं पण मला वाटतं त्या गोष्टी मी इंग्लिशमध्ये घेईन. हा अनुवादन देत असताना अग्नी उत्तम असणं हा एक पहिला क्रायटेरिया महत्वाचा आहे. त्यामुळे तो नसेल उपलब्ध तर अनुवादनाचा विचार करावा. त्यासाठी काही वेगळे स्नेह मी पुढे सांगेन की ज्या अग्नी मंद आहे किंवा कमी आहे अशा असताना अनुवादनाचा वापर करायचा आहे तर काय वापरावा. पक्वाशय गते दोषी, निराम दोषी, हे त्याची साधारणतः क्लिनिकली काय बघायला पाहिजे तर ह्या 3 गोष्टी बघायला पाहिजे. स्नेह अर्हता किंचित काल स्थितो यस्य स पुरुषो निवर्तते, किंचित काल स्थितो यस्य स पुरुषो निवर्तते. तर ह्याच्यामध्ये बऱ्याच वेळा असं असतं की भरपूर वेळ जर का तो राहिला तर तो चांगला अनुवादन, असं काही नाही. हा पहिला एक नियम डोक्यात नसतो. 45 मिनिटांच्या आसपास राहून जर का तो स्नेह पडला तर त्याचं काम झालं तर पुरुष निवर्तन व्हायला हवं. जर का तो ऍब्सॉर्ब होऊन गेला, त्याचं प्रत्यागमच झालं नाही, तर अशा वेळेस स्नेहाची अजून गरज आहे. ते लक्षात ठेवून पुढची मात्रामध्ये बदल करावा किंवा त्यानुसार अनुवासन जो आहे तो वाढावा. योग बस्ती, कर्म बस्ती, काल बस्ती हा एक प्रोटोकॉल सारखा हल्ली केला जातो. तसा करण्याची ही पद्धत नाहीये. ते एक दिलेलं सजेशन आहे. तुम्ही काश्यप संहितेमध्ये बघितलं तर त्या ठिकाणी फारच वेगळ्या पद्धतीने 4 स्नेह वगैरे अशा पद्धतीने त्या ठिकाणी दिलेला आहे, कारण तो जास्त बालरोगासाठी म्हणून आहे. त्यामुळे जास्त स्नेह आणि कमी शोधन असं ते केलेलं कॉम्बिनेशन आहे. असं कॉम्बिनेशन आपण बदलू शकतो. जर का अनुवासन देत असताना का त्याचा प्रत्यागम नीट होत नसेल आणि तुम्ही योग बस्ती प्लॅन केलेला असेल तर त्याच्यामध्ये आवश्यक तो बदल केला गेला पाहिजे. ही गोष्ट त्यातनं समजण्याची आहे. वातानुलोमन, अग्निदीप्ती, वर्चस्निग्धम, असंमतम, क्लमहा हे स्नेहपानाच्या लक्षणांमधून इथे घेतलेले आहेत. उत्क्लेश फक्त त्यातनं काढलेले आहे. त्यामुळे ह्याचं हे अशा पद्धतीने दिसणं ही गोष्ट त्यामध्ये आवश्यक आहे. जर का तुम्ही स्नेहन म्हणून या उपक्रमाकडे बघत असाल तर छठी पुष्कर, वी विल स्टार्ट बाय वन ऑइल्स अँड कृतस स्नेह. छठी पुष्कर आदि रेफरन्स इज देयर. द्विगुण क्षीर is very important here. Shati Pushkara Adi is actually a kalk combination. The Dravadravya here is Kshira. Arsha Grahani Vishamajvara Kati Uru Prushta Kosthastha Vatanulaman. This oil, these first 3 oils which I will explain is specifically for Vata dosh. Next one. Vacha Pushkaradi. Actually this name, the Vacha Pushkara, this points out many times as a Kapagna oil, maybe, but it is not so. It is more Vata Kapagna, Bruhat Panchamul Kashai and Kshir combination is a Dravadravya. And you can see the use of Kakoladi Dvaya, Chandana, Katpala, Jivaka, Jivanti as Kalka included in this one. So this is not very Ushna, but very nice Anuloman snake. Mutra Sangina is a very typical indication for this. Shati Pushkara. Next one. This is again, all these 3 oils from Shushruta for Vat dosh are having Kshira as Dravadravya. Chitrakati Vishadi. Grudrasi Khanja Kupjadhya Mutra Udavarta Rogina. One is Anuloman and this one is specifically for Grudrasi, like Sira Kandara. This action is more on Sira Kandara Dusha. So specifically this dusha is involved along with Vat dosh. This oil is better choice. Next one. Kshira Chaturguna in Bhuti Kairandadi. Yava Masha Atasi Kola Kulathaihi Kvachithai and Jivaniya. A very typical, in many oils we have seen Yava Kola Kulatha, Yava Kola Kulatha, Yava Kola. But I had tried my level best to solve this Yava Kola Kulatha myth. How this works, this combination. I have not reached any conclusion. One indication I got from Samhita is that all these 3 are Niruhanopag. All these 3 are Anuvasanopag from Charasutrasthan 1, Charasutrasthan 2. So this may be the reason why they are being used in
those snehas which can be used for Pakvashaya Shodha. What is the use of Niruhanopaga? As we use Shadharan for Vata, which is in Kapasthan, that is Amashay Gata Vata. Similarly, in Pakvashay Gata Kapha, we can use Niruhanopaga. So just give a thought. So this is a very good combination, specifically when Bala of patient is less and you have to go for Shodhan. Bhuti Kerandar. Jivantyadi Yamak Sneha. Jivantyadi Yamak in both Samhitas having little different combination but same name. So be careful what you are using, which combination you are using. Fortunately, the indications are very nearer. In Sushrut it is Kshira Ashtaguna and in Charak it is Kshira Chaturguna. Both are having indications for Mutra Reto Rajodosha. So after seeing the first four combinations of Vata Gna Anuvasan, this starts with a Pitta Gna Anuvasan, shifting like Vata Pitta. Next. Already Mahesh sir has told this Gugula Tiktaka Taila Grita. Nimbamritari Taila is Gugula Tiktaka Grita combination in Tail format. So the name Nimbamritari Tailam is Gugula Tiktaka Tailam. This is a very typical combination which comes for the rescue of a physician when he is stuck to handle Kapha Vata and Dushya is Rakta. If Dushya is Rakta and you have to address also Kapha Vata, there are very few choices we can address. This Gugula Tikta is a typical combination to address this. If it is Vata dominated, go for Gugula Tikta Taila. If it is Pitta dominated, go for Gugula Tikta Grita. It's also very much useful for Urdu Jatrugat. Sahacharadi, a main combination Sahacharadi. Again, more for Pitta. Sahachar we know, we forget the Shatavari in Sahachara. So remember, if you remember this movie Three Idiots, चांद पर पहले कौन पहुंचा था? दूसरे का नाम कोई नहीं जानता. We know what is there in the name in Sahacharadi, but we forget what is the next important content in it. So we should know the second important content of Sahacharadi. So it's more for Snayu and Rakta. Sahacharadi is a very wide range. If you are really confused, use Sahacharadi. Very gentleman, he will not trouble you. Next. Jatyadi Taila Grita. A very typical condition of Vrana. Addressing Vrana with Anuvasan is a very difficult thing. If it is Jirna Vrana, Krusha Rugna, and it's non-healing, then you have to supply such a sneha which will not create kleda but will help to heal the wound. This is good choice. Yashti Gruta Taila Keram. Again, as per dosha, can shift Yashti. Yashti Keram in Grishma Rutu, having bleed in Arsha, Rakta having continuous throbbing pain, Parikartika in this season, and there is a Tivra Buddha Sankoch is there, giving just 20 ml of small basti to just for the relaxation of Buddha to reduce Daha. It really helps. Yashti Bhrata Tailam is clear indication. Next to go Vidangadi Tailam. This is really a Taila which I am really a fan of. To decode this combination and understand how exactly it works is also again a difficult task. I don't know exactly how this will go, but I have put few things here which I understood. Sarva Kafagna, Nirohanopag. These are the maximum drugs in this Vidangadi Taila. The combination ranges huge from Kushtha Krumi up to Janayet Aprajanam Cha Prajam Trina. So this actually jumbles us exactly where to use. So specifically using the Vidangadi Tail is an indication where the Kapha is the main culprit. Where Kapha is the main culprit, but also has a very strong impact on Rasa, Rakta, and if you say up to Kshira Shukrasya. So little confusing, I use this Taila with its Phalashruti more as a Vadi Pratyani. Next one. All the set of Pittagna Sneha. Kshirbala, Amritadi, Balagoduchari, again Shatavari Ghruta Taila Kiram. All the combination of Pittagna set. Next one. Karanta Tail, Nimba Tail, and Utkleshan Tail. All these three are Utkleshan family. Karanta Tail, Nimba Tail is very nicely used as Krumigna in case dose from 10 to 30 ml as per the Balam. Basti of Karanja Tail, I learned this from Rajesh Mukhtar. This may cause Ubhaya Utkleshan. Chardan also can be seen in this patient of, we gave Karanja Tail as Basti. Utkleshan Taila, the combination is here. It causes more, it concerns more with Sthanik Utklesh of Pakvasha, less of Sarvadehic Utklesh. Next, Erendatail Chintalavan. Mahesh sir already mentioned about Chintalavan, Malashma Bhed. It's a very good thing. Erenda Sneha. Erenda Sneha is also a very, being simple, reduces its value. But if we can go for a good Yojaka, we can use this Erenda Sneha very nicely. Next one. Pippaliyadi Anuvasan. Again a combination of Niruhanopaga in Sneha used in Arsha. Atyartha Virukshitang मध्ये मूत्रकृच्छ आणि प्रवाहिका या ठिकाणी सुद्धा त्याचा वापर चांगला रीतीने करता येतो. नेक्स्ट वन. महातिक्तक घृत फलघृत. When we had to address small kids ranging from few months having kushta, and if you want to use Sneha in such conditions, it's a very tough task to use our main drugs. Mahatiktaka Ghrita can be used as a 5 ml basti, 10 ml basti, once in a week, depending upon the Agni. After 5 or 6 months, when the person starts as Kshiran Nada, baby starts becoming Kshiran Nada, better to be Annada. But from early stages also, very little doses can be used. Similarly for Jigana Jwara and Raktaja Jworottara Avastha, this Mahatiktaka Ghrita can be used. Arjaska, if you see the indication of Anuvasan, Sneha Pan is the indication, or Anuvasan is the indication for Arajaska, having less Rajat. This is a good indication. Phalagrita can be given for a very long term as Anuvasa. In some patients, I used more than 40 bastis with a needed intermittent gap for Agni to be taken care of to nourish the Rajat. Next one. Gandhak Dhruti. A very prone condition where it's likely to be PAK of appendix or of perineal axis or of any internal axis where it is likely to be PAK internally, and if you want to stop that PAK or restrict that PAK, Gandhak Dhruti can be administered as basti. Dose should not be more than 20 ml at a time. Mahasneha, even in Vata Vyadhi Chikitsa, is very nice Bruhan category of Anuvasan. If Agni is good, we can go for a Mahasneha. Some points about Anuvasan Prakshep. Shatava Sandhav has been recommended by Shalandra Samhita to be used as Prakshep in Anuvasan. In practice, we use 500 milligrams to 5 grams of Churna, finely done Churna as Prakshep. Hingu, Devdar, Indrayo, Ajamoda can be used for Shodhanartha. If you want to use that Anuvasan for Shodhan, to enhance that, you can use this as Prakshep for Shodhan. There is very nice combination given in Vagbhat Siddhistan, 4th, 59th slok. Ghute Tapta Saindhava Prakshepa. Old lady, nearly in coma, only Asthi and Charma in Shesh. In such patients, Shodhan is to be done, but very less Bala. If even the little more Shodhan can cause Pranahani. For this, I use this combination. You have to heat Saindhav for a quite good time, then go for Nirvap in Ghrita and use that Ghrita for Basti. Same Anuvasani is to be used for Ropan and Prasadanartha. In such condition, Pravar Pishti or Shatavari Kalpa, Gandhak Rasayan or Yashti are used as Prakshep in Anuvasana. Also, it's better to be used with Ghrita and Kera if the more indication is Ropan or Prasadana. Next, Yashti, Madan and Bilva are three common dravyas in Niruhanopaga and Anuvasanopaga Gana. Increasing the quantity and reducing the quantity, the matra changes the action. Anuvasanopaga is primarily Vatanuloman and Shaman. Niruhanopaga is more Kapagana and Vatanuloman and Malanuloman. Again, it gets confused when Charak in Sutrasthana 2 he notes down all Niruhanopaga and says anything, any sneha prepared out of this Niruhanopaga is Anuvasanopaga. So again the same mystery persists. So but for my practice, in my mind I kept this discrimination, what drug to be used when. Thank you very much for giving me opportunity to be here.